Right. Hello, everyone. My name is Teresa Chan. We've begun recording, and this is our, it feels like maybe 1 millionth webinar, but it's probably only just been about a couple dozen webinars that we've had since the beginning of the COVID-19 pandemic. This is probably another digital offering that we'll be putting together to the rest of the world. And I'd like to welcome you here today to join us to discuss virtual clinical skills. So to think about how we might approach clinical skills in this new virtual world, but also to think about how we actually need to teach skills that need to be done in person virtually right now during this unusual time that we're living through. And so I'm gonna definitely thank everyone for coming, and I'm going to basically ask Dorothy to advance the slide, and I'm gonna do our traditional land acknowledgement. McMaster recognizes and acknowledges that we are located on the traditional territories of the Haudenosaunee and Anishinaabe nations. This territory is covered by the Upper Canada Treaties and is within the lands protected by the Dish with One Spoon Wampum Agreement, and is directly adjacent to the Haldeman Treaty territory. And we're really excited that everyone is here today. And what we would suggest is that if everyone could take a moment and think about the traditional lands in which they are hosted, because we know a lot of people are in different jurisdictions. And so you probably have different people that you need to thank in your mind for being able to be here. And just take a moment to reflect on that, and then we'll move on. All right, so we'll go on to the next slide and kind of run through everything. What we're going to do is we're going to ask you to, at this point in the meeting, note that it's being recorded. We're going to ask you to turn on your camera if you're a speaker for higher interaction. And later on, there will be some breakout rooms where you will get to turn on your cameras as everyone else. And then definitely in the Q&A at the end, please turn on your cameras. We're going to ask you to mute yourself, and I will actually mute you when you're, unless you want to speak. And then in which case, just go ahead and unmute yourself and let us know, or you can type a comment and let us know you want to speak, and then unmute yourself. Hopefully you can stay for the whole thing. We're not going to do this for very long, so we're going to try to keep this a tight presentation, but definitely we're asking you to try not to jump in and out if you can, unless you have a lot of bandwidth issues, which we understand if that happens. And you'll be getting a speaker evaluation form at the end, and our speakers definitely value the feedback. So thank you so much in advance for the survey that you'll fill out. Without further ado, I'm going to kick this over to our first speaker. Dr. Dorothy Backer is an assistant dean in the Faculty of Health Sciences. She's the assistant dean of the MacCare program, which is a really neat program that really spans a large geographic footprint and allows us to have a very diverse group of teachers in areas that traditionally might have not been included in medical education and health professions education. And because of her leadership, we do have a lot more regional involvement in the education of our trainees. So we're really excited to have her here presenting about some of the things that she's done in virtual patient care simulation sessions. I heard about this and I just thought it was so cool. So I'm really glad that Dorothy, who normally stays behind the scenes and has been helping out with all of these webinars, is here front and center, actually starting in her own thing. I'm going to kick you over and put you on spotlight for this part, Dorothy.
Great, thanks, Teresa. You can hear me okay?
Yes, I can hear you just great. Thank you.
Okay, that's great. I just want to take a few minutes to talk about something we did in undergraduate medical education. So the medical students in their virtual longitudinal clerkship. So when COVID-19 pandemic came on full force and we had to shut down in-person clinical activities for the medical school, this was one of the offerings during the virtual longitudinal clerkship. So essentially, you know that medical students, like any health professional student, is pretty eager to learn and adopt to the virtual care environment, just as we are as clinicians. And they've had varying amounts of experience, but really they're feeling kind of anxious about it and worried about how they're going to interact once they get into their clinical and clerkship settings, which to a large part could be in a virtual patient care environment. So what we did is we set up some clinical skills, but really sort of augmentation of the communication sessions that they learned in professional competency training that were geared toward really communicating with patients using standardized patients, simulating patient encounters, but in a virtual environment alongside a faculty facilitator. So this was what was new. Instead of having a group of students in a small group environment with their facilitator and standardized patient in the same room, it was now done virtually using either a computer or their tablets or phones, whatever device they could use. So the objectives of these virtual patient care simulated sessions was to help them to get some of those basic skills needed to be able to communicate either with patients or indirectly with patients' family members through the virtual patient care environment, and helping them to learn some of those communication skills necessary not only with the patient but also with their preceptor, who often would be either listening in or looking at a recorded session. And we also hope that they would be able to get some appreciation of how to manage a patient safely in this type of environment and how to know when they should transition to an in-person visit. So those were some of our objectives. How we set it up is in the medical school, there's over 200 students per class. So for this class of 21, there's 206 students. We wanted 5 or 6 students per session. Along with a faculty facilitator and a standardized patient. So that actually made 35 separate sessions with 5 to 6 students per group. And we organize these sessions by booking video conference links to WebEx in our case, but you could easily use Zoom or whatever platform you prefer. So, and as I said, they all linked in these individual groups from their smartphones or tablets or computers on the date and time that their session was booked. So how did this run? Well, we took the 2 hours and sort of split it up evenly amongst the students, allowing for some time for introductions and time for overall feedback at the end. And that essentially gave about 10 minutes each per student to interview the standardized patient. And then we also had maybe 7 to 10 minutes afterwards where the group would give feedback to that student who just completed the scenario with the standardized patient. This is commonly done in professional competencies, so they, at this point in their training, were quite familiar with this process, but this is the first time that they were doing it through a virtual environment. And then after the first student's done, then the second student would go on with the same standardized patient, but in the next scenario, which was sort of consecutive in time in how these scenarios were built. And so on until all the students were done. These scenarios were all in a primary care environment and were all as a 10-minute visit. And 2 of them were with the standardized patient who had medical concerns themselves. 2 of the scenarios were that standardized patient who had questions or concerns about an elderly family member that they wanted to talk to the clinician about, and the other 2 were talking about a child. So it gave a variety of different scenarios that the students could test out and try, and they got a little bit more complex as the sessions went on. After each of their 10-minute sessions, as I said, we did a debrief, the group, both the students in the group, the faculty facilitator, and the standardized patient gave some feedback on a variety of things. But what we were trying to focus on were things like what we might now call website manners. So how, first of all, was their technological setup? Was the lighting okay? The sound? Were they allowing for lags in the internet possibly so that they could hear one another? How was the appearance? Did they look professional? Was the background professional as well? And still the age-old communication skills, types of things were looked at, like their body language and even eye contact on a video conference. And then there were other things more specific to the virtual patient care environment that were debriefed. So checking in and allowing students to have the practice of discussing the risks and limitations of virtual patient care encounters, and not forgetting to obtain consent, verbal consent on the encounter. Also, did they indicate whether or not this was a recorded session? And finally, a discussion toward the end that included a summary and whether or not the next visit should be in person and when that was most appropriate, or another virtual visit would be booked. So that sort of gives you an idea of what we did through the virtual patient care simulation sessions. At the end of each session, we tried to leave at least 10 minutes for general feedback to both the standardized patient and facilitator on how, and to the group on how the session went. And there was also time to complete a feedback form. Most important thing on the feedback was a section for reflection. And this was really an opportunity for the students to think about how might what they learned in these simulation sessions be used in real life. So here's what we asked, and honestly, the reflections were quite incredible and thoughtful, and it appeared to be a very valuable experience for them. So we asked them to reflect on how they would apply their learned or practiced skills in an actual virtual patient care interaction in the future, and maybe comment on some elements such as the technology, relationship building, consent, and documentation, because these were some of the areas that we tried to concentrate on. That's about it, what I wanted to share with you. It actually turned out to be very successful. Students found it very beneficial. We had excellent feedback. This form, this sheet just gives a quick reference with a web link here at the top, where you can find all the resources, including the feedback forms and facilitator guidelines and so on. So that's the piece that I wanted to share with everybody. It's just one way to try to help with clinical skills, and this is communication skills specifically in virtual clinical skills. So thanks, Teresa, for that opportunity. I'll hand it over to you to maybe go to the next person.